My name is Tim Kelsey. I am the Chief Executive of the Australian Digital Health Agency, and I'm currently in Delhi, in India. So the Australian Digital Health Agency was set up in July last year, and the intention was by all the governments of Australia to harness the power of the modern information revolution to empower and enable clinicians, to offer industry and entrepreneurs and innovators a new platform for delivery of new services for patients and citizens, and ultimately to provide citizens with new ways in which they could engage with their health and well-being. The agency has recently had the new National Digital Health Strategy approved by the Government of Australia, and that calls out 7 key priorities for Australia. The first of those is a program to give every Australian citizen a personal mobile health record, which they can access through their mobile telephone, they can access online, which they also control, and which they can share with their clinician if they choose to. And that program will have given all Australians access to a mobile record by the end of 2018, unless, of course, they choose not to have one. So that's the first priority in the new strategy. The second priority is around providing clinicians, doctors, nurses, allied health professionals, with tools that enable them to communicate securely with each other without recourse to the fax machine, to paper-based healthcare. I think we, in common, India and Australia, have the challenge of ending the age of paper-based healthcare and delivering digital services that will enable secure, real-time communications between clinicians at the front line of delivery, something which, certainly in my experience, clinicians in both countries have been asking for a long time. So I won't go through all the 7 priorities for the new strategy, but they're available, of course, online, should people be interested to explore them. What's called the My Health Record is a summary of a person's health information. It includes their medications history, their pathology reports, radiology reports, and many other items of information. It's not a comprehensive EMR type presentation of information. Instead, as I say, it's a summary of a person's health information accessible online through their mobile telephone, and something that is shared with their clinician. I've worked in the English NHS and had the privilege of working with a number of different countries around the world, and the Australian programme is, to an extent, unprecedented. It is really the largest programme on its scale to offer people access to such information. It's quite different to the concept of an electronic medical record, let's say in a hospital or in a general practice, where you have fully comprehensive records of a person's medical history. This is intended to be a summary, so that, for example, if somebody is in an emergency situation, the physician treating them, the paramedic, is able to access key items of data about them, their allergies, their medications, so that errors are avoided. And indeed, if somebody is managing a chronic illness, they perhaps are on holiday, the clinician treating them, who may not know their history, is able to use this My Health Record to identify key history that will help them prevent an error and improve the outcome for that patient. Well, I have been a student of India's tremendous contribution to global health innovation through advanced and innovative uses of data and technology. I've spent this afternoon at the Rajiv Gandhi Charitable Trust looking at work they're doing there to promote the empowerment of women in remote and rural communities, particularly so that there is an improvement in outcomes in early years, in post-birth, in children and maternal health care. And there's been a remarkable sophistication in the use of technology to empower conversations about better health in that particular work. We are going to Bengaluru later this week to look at the work, for example, that Devi Shetty has led, transforming outcomes and costs in surgery through, again, amazing uses of technology. So, first of all, we can learn much from India. The Australian Digital Health Agency has a specific responsibility to learn and to contribute to the international reflection on how digital health can best be put to use for clinicians and their patients. And I feel there are a number of ways in which we can develop, are already developing, a really constructive conversation about different kinds of approaches. So in Australia, for example, under the new strategy, we are prioritising the development of standards, data standards, that will support seamless interoperability of care services, of data flows between care services, including things like SNOMED CT, and the use of unique patient identifiers. And I think there's quite a lot of learning we have in Australia that can support the Indian priority to try and develop truly interoperable health services across the kind of organisational and jurisdictional boundaries that exist. So we've heard during the course of the first day of Australia-India Business Week just the amazing fertility and enterprise culture that India has developed. We've also heard of the extraordinary scale of the demographics of this nation, which I think just render an incredible opportunity for global innovators to be investing in Indian healthcare. I know that there are many colleagues from Australia in this delegation who are absolutely already very engaged in supporting improvements in Indian health outcomes through lessons in Australian technology development. So my impression very strongly is there's a fantastic opportunity for bilateral collaboration, for joint learning, for the development of innovation which will contribute to the economic and health outcomes of both countries. So I think we're at a bit of a tipping point. And I think if you look at all the lessons from countries that have invested significantly in digital health services for the last decade or so, the story has been pretty mixed. And clinicians, consumers have, I think to some extent, been rather disappointed by the way in which technology has really not reached the standard they're used to in the rest of their lives in healthcare. You think for a minute about the way we now, of course, engage with the internet to book our holidays, to engage with financial services. You think in the context of more rural, more disadvantaged communities, the way in which online tools are supporting development of very innovative microfinance initiatives. Yet none of that learning really seems to have impacted on the way we are empowered in our healthcare as individuals, just as patients or citizens, parents. And I think that what all of us need to recognise is that the next 5 years isn't going to be, in my view, about moonshots, about silver bullets. It's going to be about just getting the basics in place. Healthcare in Australia, just as it is in India, in England, other countries, is still dominated by the fax machine. It is still a paper-based industry. It would be unimaginable, if you think of the airlines industry, for us to tolerate such a safety critical industry still being dependent upon fax machines. I mean, in the way that we appear to be tolerant of that in healthcare, an equally dangerous industry, and one which of course prioritizes safety. So I think for me, the urgency is to get the basics in place, to put in place those digital information sharing tools that will reduce dependency on these very dangerous, archaic, paper-based systems that we know are costing people's lives, that are responsible in part for the rising number of adverse drug events that take place in all our countries. So I think we need to be careful about over-hyping or inflating the vision. Because really what we're doing is building the foundations. Now, it is also important that whilst we put those foundations in place, we recognise the responsibility we have in this generation to our children and their children to make sure that the foundations will deliver us to offer the opportunity of the new sciences in healthcare, genomics and molecular diagnostics, because those cannot be delivered on paper. They are entirely dependent upon digital means of information sharing, and not so. In summary, my view is that 5 years from now, I think many countries in the world will have got the basics in place. I'm sure India will be very far advanced in that trajectory. Certainly, our hope is that Australia is, and then increasingly as we begin to abolish paper as the currency of healthcare, we're able to open up the opportunity of new science in medicine for ourselves and for our children. Better use of technology in healthcare is the first priority of any health service that is attempting to deliver high quality, sustainable health outcomes for its patients and for its community. And the reason for this is that if we do not put in place means of secure digital sharing of information, we will not be able to deliver reductions in adverse drug events, improvements in the coordination of care for our community, nor will we be able to deliver reductions in current duplication of diagnostic and other tests for people. The costs on society of a paper-based health service is enormous. The inefficiencies are tremendous. Clinicians find the administrative burden takes them away from those crucial moments in which they can actually counsel and care for their patients. Technology is a key enabler for a modern, high-quality, sustainable health service.